VCY America presents Crosstalk, a nationwide call-in program discussing issues that have an effect on our families, our communities, our churches, our nation, and our world. Crosstalk, an opportunity for you to voice your concerns for biblical principles. And now live by satellite and around the world on the internet at vcyamerica.org. Here is today's Crosstalk.
And welcome to Crosstalk on the VCY America Network. My name is Jim Schneider, and folks, we're going to hit the topic that has stirred this nation. Little number of topics have stirred the nation's attention, like the topic of health care and affordable health care. One public health nurse from Minnesota, well, she has a very important perspective to share on this issue today. Her organization is Citizens Council for Health Freedom, working to ensure that all Americans are protected in their health care options. Her name is Twila Brase, and she is the president and co-founder of the Citizens Council for Health Freedom. She's a registered nurse. She provides testimony at the state legislative level, also before the members of Congress, speaks around the country. She has been labeled one of the 100 most powerful people in healthcare and one of Minnesota's 100 most influential healthcare leaders. Twila, thank you for joining us again on Crosstalk.
Thank you so much, Jim. Glad to be here.
Gradually, we are seeing the implementation of the Patient Protection and Affordable Care Act, which many have dubbed Obamacare. If nothing is done to repeal this, health care as we know it is never going to be the same in this country. And today we want to focus in on a particular aspect of the implementation of this health care and the changes that are coming about. And that comes under the guise of what is called the state health care insurance exchanges. But before we delve into it, Twila, could you first of all explain for our listeners exactly what are these insurance exchanges? How are they going to work?
Well, I think probably the best way to look at it is what is being said about them and then how we view them. So what the proponents of the exchanges are saying is that this is a one-stop shop, a place to come and buy health insurance, something that's very easy, something that you can just do online. It's just a website that you go to, and every state will have one, and you know, your choices of health insurance will be there, and everything will be just grand. But we don't look at the health insurance exchanges as that. First of all, the fact is that they're being imposed by the federal government under the ACA, Obamacare. They're being imposed, so they're being imposed with a law, and they're being imposed with a whole host of regulations, which means that behind the scenes, what people won't see, there's a lot of stuff going on. And what's going on back there is the fact that there will be so much information about every person that is available to the exchange, and then that is shared between the exchange, this online website portal. It will be shared with the federal government through something called a Federal Data Services Hub. It is being created by the federal government. It is where all the data has to pass through when you come and come to buy insurance. So you're coming to just a website. You're just on the internet. You go to the website. It looks all very simple. You put in a little bit of information, but what you don't know is that information plus more information on you that is provided by the state government and by the federal government, like your tax forms, your medical records, all of that is then shared through this Federal Data Services Hub with at least 5, maybe 6 agencies in the federal government.
We're talking a breach of patient privacy, aren't we?
Yes, patient privacy, tax privacy, and we're talking about something that is different than it's being declared to be. So really, when we look at the exchange, we don't look at it as a place to buy health insurance, although you will buy it, but we look at it more as a registration system. It's registering your compliance with the Obamacare mandate to purchase health insurance. And part of the reason I say this is if you look at some of the prototypes out there, the videos, you can see how they plan for it to work. And so people who don't buy insurance come to the portal, come to the website, come to the so-called exchange, and they tell why they are exempt from the mandate. So they have to register their exemption from the mandate by going into the exchange, and that is sent to the IRS, and then it's registered. So we look at it, this whole exchange system, not as a place for the purpose of buying health insurance, but really for the purpose of registering your compliance with the mandate to buy insurance.
So that's how the IRS is connected to this whole thing?
Right. The IRS is connected through the Federal Data Services Hub. And so employers will go to the exchange and register all their people when they buy insurance for them. Individuals will go to the exchange and register their compliance by buying insurance, or individuals will go to the exchange and register the fact that they are one of the exemptions from having to buy health insurance. The employers that don't go to the exchange and buy it yet also have to tell the IRS who all their employees are. They have to give their tax ID number, they have to give their name and other information about them, so that if any employee of one of those larger companies who isn't yet going to buy on the exchange, if any employee decides that they're going to buy their health insurance through the exchange rather than taking the coverage that the employer offers, then the IRS will contact the employer and say, by the way, one of your employees has registered and is purchasing insurance on the exchange, and that means that you have to pay a fine, because there's a fine in Obamacare for any employer whose employees come and buy health insurance on the exchange.
What type of fine?
The fine can be up to $3,000 per employee. So let's just say a company has 100 employees, for example, and one of them goes on the exchange and buys their health insurance. Well, then the employee gets fined up to $3,000 per each employee. So 100 times $3,000, right?
Is it the employee or the employer that gets fined?
The employer gets fined.
When you talk about this, it sounds to me like a national database on every citizen.
In a way, it is. It's such a huge sharing component here that the states must share information with the federal government through the Federal Data Services Hub, or we'll just call it the Data Hub. Okay, so the states must share their information, like tax information and medical record information, and the insurance companies have to share information, and all of it goes between the federal government and the state government. So although there may not be a, quote, central database, there is a central transaction and sharing mechanism called the hub. And so it's not like everybody's data is sitting in one place, but it's just accessible from one place.
Who, aside from the IRS, is going to have access to this?
The Department of the Department of Health and Human Services, the Department of Justice, the Social Security Administration, the IRS, and I'm not looking at my diagram at the moment, but there is a diagram online that we have that shows all the different federal agencies.
We're speaking today with Twila Brase, who represents the Citizens Council for Health Freedom. Twila, as you know, there are some states that are standing up and saying, no, we're not going to implement these exchanges. But in light of the recent Supreme Court decision, do states have any option to refuse or set up exchanges or participate in this Affordable Care Act?
Right. Actually, they do. The one thing about Obamacare and the exchanges is the fact that, as the justices even talked about with the Medicaid decision, is that the federal government under the Constitution cannot commandeer a state government, which means they cannot take over. They cannot force them to do all these things. So the law does not actually require that a state insurance exchange be set up. It says that every state shall do it, but knowing that they couldn't actually force the states to do it, they put in a fallback. And the fallback is that any state that doesn't do it, the federal government can come in and establish a federal exchange. Now, that probably sounds a certain way to your listeners, and I just want to explain exactly how that would work. Because the federal government is right now trying to pull together and to create a, quote, federal exchange, just one exchange. And that would mean that there would be a federal a federal website portal that if your state didn't have a state exchange, you'd have to go on the internet and not go to the state exchange because one doesn't exist. You'd have to go to the federal exchange, which means you just have to go to the website that's called the Federal Exchange. So there will be one federal exchange created, and then the federal government is going to have to somehow force people to go there. Well, two things about this that your listeners might find of interest. The federal government keeps saying to states and to people that if you set up your own exchange, you won't have the federal one imposed on you, and you will have more control. But that's not true, because, in fact, the law says that whether it's a state exchange or a federal exchange, it must follow the same law, Obamacare, and it must follow the same rules, which there's about 4 different exchange regulations that have already been issued. There isn't any difference except for the fact that the state exchange is going to have a different title, like, Minnesota Exchange or Oregon Exchange or Florida Exchange, right, instead of a federal exchange. So there's really no difference whatsoever. It's just that the federal government was really hoping that states would do this, one, so that it hides the fact that this is all really about creating an entire federal system. Whether you call it a state exchange or a federal exchange, it's all the same system doing the same thing. So they were kind of trying to hide the whole national takeover by having a state exchange. The other thing is that it's going to cost a state between $10 and $100 million a year to operate the exchange. And the federal government was hoping that this would be money that the state taxpayers would pay, not the federal government. So, I think there are two reasons to try and confuse the public about this.
So if a state actually sets this up, this is going to impact their state budget, but if a state stands up to the federal government and says no, then it will not impact their state budget?
That's right. Of course, the federal government could come and say, well, then if we set it up, then you have to pay us something. Well, okay, maybe. Aren't they going to come in with the police and try and, get funds? Right? They're operating just a website somewhere, and now they want the state to pay money in order to have people get on their website. I think it becomes very difficult for the federal government to try and impose, this kind of a transaction on the state, or this kind of requirement. The other thing is if a state says no, not only do they show the entire public the fact that really this is all about the federal government taking over, but they also protect all their businesses against this $3,000 per employee penalty. Because if there's no exchange, no state exchange to go to, no business can be penalized because there's no ability for their employees to go buy health insurance elsewhere.
Do you have a listing of states that are saying no?
I do not have a listing. No, we don't have that on our website, but there's 13 states that have said yes, and most of them are very, 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 very not advanced. They are nowhere near the 109 milestones set by the federal government. Massachusetts, which already has an exchange of their own since 2006, is only 56% of the way to the 109 milestones. So you see this whole idea of the state having any power against the federal government. There's 109 milestones that every state exchange has to meet. It's not possible. So I'll just say there's 13 that have said yes, but they're not very far along at all.
Okay. Twila Brase is with us here today on Crosstalk. We're talking about the state health care insurance exchanges provided under Obamacare. Folks, we've got a lot more information to come. You're listening to Crosstalk on the VCY America Network.
Back to Genesis with Dr. John Morris, scientist with the Institute for Creation Research. Dr. Morris, are zebras the same basic kind of animals as horses?
Chris, zebras are counted as a separate species of animal, and yet they have been known to interbreed with horses and donkeys and now even a Shetland pony. Zebras are different from horses in more ways than just their skin color pattern, most particularly in the number of chromosomes which they carry. I used to suspect that a different chromosome count would place that animal in a completely different created kind, but now we know there are ways in which animal groups gain or lose chromosomes. It's difficult to know just what the created kinds were back in Genesis, but our best approximation nowadays is based on whether or not they are potentially interfertile. A lot of research needs to go on, but we are refining our understanding of that back to Genesis world.
We'd love for you to drop us an email with your question for Dr. Morris. Contact us at genesis@icr.org.
Our guest today is Twila Brase. She is with the Citizens Council for Health Freedom. She is the president and co-founder and also a registered nurse. She has testified several times, not only before state legislatures, but before members of Congress as well. Twila, I can see as that clock keeps ticking away that we're just going to be able to scratch the surface on the topic. You're getting lots of good information, but you've got a whole lot more that's available on your website. If you'll tell our listeners about how they can obtain that from your site.
Sure. Just go to www.cchfreedom.org. cchfreedom.org. And we have a special page that has to do with the health insurance exchanges, which you can just click on the right side. It's just a little thing right there, and then they'll give you all the information, all our diagrams, all our press releases, all the data that's being shared. We actually have an example of all the data that is being shared through one of the contracts to build the exchange. So, it should provide enough information for your folks. Okay,
again, folks, that's CCH Freedom. That stands for Citizens Council for Health Freedom, cchfreedom.org. Twila, our governor, Scott Walker, who has obtained national notoriety now because of the recall election and positions he has taken, is one that is bucking Obamacare, and he not only allowed the Attorney General to join in that lawsuit by the states, but also said that he is not going to be setting up this any kind of exchange. He's waiting right now for the election to take place, but he is being warned by his counterparts, you must do this or you're going to put our state at risk in this regard. But what I heard you say during that first segment is that Governor Walker would be doing the right thing right now by not giving sway here to the Obamacare dictates.
Right. We actually call the Health Insurance Exchange a federal takeover center because it is the arm of the federal government coming into each state, gathering data on everyone, getting their registration, knowing exactly who has signed up and who has not signed up, deciding what kind of plans you can have, what kind of benefits must be offered and what kind can't be offered. So once the exchange is set up under Obamacare, it becomes a federal controlling structure. So that's why we call it a federal takeover center. So to protect the state and to protect the state budget and to protect individuals' choices of health insurance and medical decisions, you really have to prevent the exchange from ever coming into, from ever being established in the state of Wisconsin or in any other state around the country.
Good. I mean, what I hear you say basically is that those states that set up these exchanges, that it's going to greatly increase their state debt, it's going to increase the taxpayer burden as well?
Right. Yes, because Massachusetts, for instance, in their exchange, which they have had since 2006, their exchange cost around $30 million to operate every year. Oregon, who is looking at this, came out with a paper, and their exchange was going to cost around $36 million a year. Minnesota's exchange has been estimated to cost between $40 and $80 million a year. That cost is either going to come or be paid for through higher taxes or through higher premiums, because if the exchange charges the health insurance company who is on the exchange, if they charge them user fees, the health insurance company is going to turn right around and tack that cost onto health insurance premiums. So no matter what way it happens, those are dollars that are going to be paid for by the average person, by the person in the public, by you and me and citizens everywhere.
Twila, you have indicated through press releases that the state of Minnesota is, which we have a few stations that are picking up this program now, but you've indicated that Minnesota is leading the nation in implementing the state health exchange. What is Minnesota doing that puts them at the head?
Yes, it's not a head that we'd like them to be at, but what Governor Dayton did was, when he could not get the legislature to sign a bill implementing and establishing the exchange, he wrote an executive order, and then he asked for the federal dollars. So he has around $31 million from the federal government in exchange money. It's their exchange grants. And then he has put together a team of people in part of the Department of Commerce, and they are working moving forward to build the exchange, even though there's no law that allows them to do it. And they will not be able to continue moving forward unless they get a state law and state money. And it is our intention as an organization to make sure that that does not happen.
Couldn't the U.S. Congress just deny funding for Obamacare and just put an end to this thing?
Well, they certainly could. At least they could try, but they would, of course, have to get that also through the president. Because you can deny the funding, and then it becomes part of a negotiation, right?
Well, or the continuing resolution that keeps the government operating. They have to put this together as they come back from recess. The continuing resolution where they're going to put out monies.
Right.
And I know that there's been a pressure by some put upon Speaker Boehner to just not allocate any money here for the implementation of Obamacare.
Yes, and that has been discussed, and we don't know what's going to happen with that. But what we do know is that states have already millions and millions of dollars, like Minnesota with $31 million. There are other states that have like $140 million. The administration tried to put out this money as quickly as it could, and before the lawsuit, before the ruling came down from the Supreme Court. So they even, 4 or 5 weeks before the ruling, they put out an additional, I think it was $181 million to states. Because their idea is once you get it established, it will have its own constituency, and states will find it difficult to get rid of it. And when you understand that the exchange is the heart of healthcare reform, it is the centerpiece of Obamacare, and it is the way that the federal government will take over the healthcare system, then you understand why they doled out so much money already. It's over $1 billion that has gone out to build the exchanges.
Twila, we're hearing a lot about Medicare in this upcoming election. Is it true that the Affordable Care Act, Obamacare, has taken about $700 million from Medicare and put it in Obamacare?
Yes, and it's interesting phraseology. In the Obamacare bill, it takes out about $700 billion.
Oh, billion?
Billion, and transfers it to money that will go for expanding Medicaid primarily. So it's, when they talked about saving money in Medicare, but they really didn't save any money because they actually are using that money to expand Medicaid around the country. Of course, now that we have had the Supreme Court ruling, which gives states the right to say no to the expansion, we're uncertain how many states will actually move forward. But that is the fact of the matter is in the law. They took money from one program, Medicare, and gave it to another, Medicaid.
We came across a news story yesterday that stated that one of the provisions of President Obama's health care law imposes what's called a second Medicare tax on investment income for Americans classified as wealthy. I believe that's combined income over $250,000. They report that this new 3.8% Medicare tax on investment income goes into effect after this coming election, going into effect on January 1st, 2013. If this story is correct, Twila, that tells me that there's going to be a number of Americans that are going to be taxed twice. Both the Medicare tax that they're already paying and then the second tax that will be coming. Right.
There are 21, people count it differently, but there's about 21 new taxes or expansion of taxes in Obamacare. One of the expansions is that people over, I'm trying to think if it's $100,000 or if it's $200,000, will pay an additional payroll tax of 0.09%. And so they will be paying more just in their payroll taxes. Then you're talking about the 3.8% tax, which also is for people making more money. And that one gets paid on investment income and second homes, not the first home that you would sell. And so that is indeed a tax that is in there. And it is interesting, sort of the timing of the taxes, because if that tax would have taken place this year, for instance, then more people might have felt differently about the law prior to the election.
We're even taxing the taxes.
Right.
What impact is this going to have for businesses, this Affordable Care Act, the Obamacare?
Okay. Businesses are going to be hugely impacted because of all the penalties, because of the mandate for them to offer insurance to their employees or to pay a fine. So there's that employer mandate. There's also, as I said before, there's the fine if any of their employees go to the exchange and buy health insurance. And it's all very complicated as to definitions within the law and how each of those definitions will impact an employer, including there are definitions about a small employer, and a small employer may or may not be what you think one is, but it is according to the definition, and that definition changes in different circumstances, including seasonal employees, et cetera. And so employers are going to have to deal with a whole lot of administrative know-how to even know what their impact will be out of the law. The other thing is because of the taxes on people making over $200,000 or $250,000, oftentimes those are individual entrepreneurs who are running their entire business through their own bank account. And so they will get a tax that is actually about their business, but they're being looked at as an individual, and they will be taxed as though that was all their own individual income, not as though it was through their small business, which is the reality, but that's not how it's going to be looked at.
Twila, we've got a lot of information you've given here in this half hour here, and I know you have so much more available on your website on not just, we're confined our topic here to the state health care insurance exchanges, but there's so much more that's wrapped up into what was passed or deemed to have passed by Congress. Give us again your website where our listeners can have more information, and I know you have, email updates that our listeners can obtain as well?
Right. The website is cchfreedom.org, cchfreedom.org, and we have a weekly e-news, which a lot of people are signing up for all around the country, and you can just click at the top of our website is where you can click to get a subscription to that, and it just comes once a week, and it provides information that a lot of times you won't find other places, or perhaps a new insight on the information that is being talked about.
Okay, cchfreedom.org. And for those who don't have Internet access, how can they be in contact with you?
Well, they can always give us a call and get on our mailing list, and they can call us at 651-646-8935.
Okay, so you have, a newsletter or something you send out? Or
Yes.
Okay.
Yep. Twice a year at least.
651, area code 646-8935.
That's correct.
Well, folks, we're going to take a quick 60-second break, but let's open our phone lines. You can get on board right now with your questions, your comments. Our number 800-733-9829. How do you react to all of this? There are changes coming, folks, like we've not seen before. As we mentioned, healthcare as we know it is going to go out the window. Our number 800-733-9829. We'll be back in 1 minute. Get on board. Give us your call here at Crosstalk. Our guest is Twila Brase with Citizens Council for Health Freedom. We'll be right back.
The basis of scientific research is to find the truth, and scientists, of all people, are supposed to have open minds and be willing to look at all the evidence. However, history has told us that once an idea has become entrenched, even scientists find it difficult to accept anything that deviates from the idea. This is now the case with evolution, and the theory of evolution is now a dogma. Refuting evolution has now been taken to a new level. In the book, Evolution Impossible, Dr. John Ashton provides some of the most compelling and authoritative rebuttals of evolution today. Chapter by chapter, in straightforward language, he provides 12 compelling reasons why evolution is false. He uses discoveries in genetics, biochemistry, geology, radiometric dating, and other scientific disciplines to explain why the theory of evolution is but a myth. Evolution Impossible is available from VCY America for a donation of $17 or more by calling 1-800-729-9829. That's 1-800-729-9829.
You're listening to Crosstalk on the VCY American Network and taking your calls today, your questions, your comments as it pertains to the state healthcare insurance exchanges coming to a town near you. That is, if the federal government has its ways and wanting the states to set up these exchanges. There are some states who are saying no way. We have seen a number of states doing that. Others are just leading the pack as far as getting these, taking the federal dollars. But with those federal dollars, there are many strings attached, part of which is many, 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 many more millions of dollars that you, the taxpayers, are going to have to kick in order to fulfill the requirements by the federal government. Twila Brase is with us today. She's with Citizens Council for Health Freedom, and we're taking your calls here at 800-733-9829. Let's begin in Ohio. James, thanks for calling. You're on the air.
Yes, I had a question about if on a family farm, all the employees are, because I work on a family farm, all the employees are family. What would happen if the employer and the employees refuse to get on the exchange?
What would happen if the employer and the employees what?
Refuse to get on the exchange.
Oh, refuse to get on the exchange.
Yeah, if both of them refuse to get on the exchange.
Right. Well, the employer would be forced to pay a penalty. Any employer who chooses not to offer health insurance to their employees, they have to have, I believe the cutoff is 50 employees. If you have 50 employees or more, you have to offer health insurance or you are required to pay a penalty. If the employees choose not to, then they're under the individual mandate, and they also have to pay a penalty, which under the Supreme Court they called it a tax, for refusing to buy health insurance.
Okay. Thank you.
You're welcome.
Appreciate your call here. Let's go from Ohio to South Dakota, Lake Andes. Tiffany, go ahead. You're on the air.
Hi, I just had a question. I regularly call the governor's office, and they say that they're looking into what the repercussions are if they refuse to implement Obamacare. How can I urge them, or what facts can I give them, or where exactly can I direct them to give them more information saying that they'll be protecting pretty much their citizens if they refuse?
Yes. I would suggest we actually have a special web page for this issue, the exchange issue, and that's really when we talk about implementing, it is adding to state law things from the federal law, and one of those things is the health insurance exchange. Another one is called essential health benefits, but that's also about the exchange. Another one has to do with the Medicaid expansion, which would be through the exchange. So really, I think stopping the exchange is so critical to stopping the implementation of Obamacare. And so if I were you, I would just direct them to our special webpage, which has to do with this issue, and it's called StopHealthInsuranceExchange.org.
Give that to us again.
StopHealthInsuranceExchange.org.
And this will help states in particular?
This will help anyone. It is our webpage that has to do everything about the health insurance exchanges, all our concerns about them, all our diagrams about what it really means, our diagram about the Federal Data Services Hub. All of that stuff is on that one page.
Awesome.
StopHealthInsuranceExchange.org.
That's correct.
Thanks. I'll hang up with you, and I'll call them right away.
Thank you, Tiffany.
Thank you. Bye.
Bye-bye. To Madison, Wisconsin. Randy, you're on the air.
Yeah, I had a question. Currently, customers can go on the Internet, like e-insurance. Apparently, that's about 15% of the market, where they could get insurance on their own through this e-insurance. How does this exchange situation impact getting insurance through e-insurance, for example?
Well, e-insurance is going to be still working and will be competing with the government exchange. And it's our belief that this is not having to do anything with buying insurance. It is having to do with registering your compliance with the exchange. so that the government can move us all towards universal coverage. But be that as it may, if we were talking about it just as if the purpose is just about buying and selling health insurance, then it would be just about competing with the between the private exchange and the government exchange. We do believe that the private exchanges will probably excel, and it will be difficult for the government exchanges. But then that could be, as some have said, that if it is difficult for the government exchange to actually stay in business, it might be that the state would have to require everyone to buy health insurance through the government exchange. And so that is something that a state could decide that they wanted to do in order to preserve the exchange, to make sure that it had all the money and everybody in it to preserve the life of it. Of course, we don't want to go in that direction, but that is one of the possibilities that could happen. I don't think e-health insurance is going to give up the ship yet, and hopefully it will be private exchanges whose sole purpose is about selling health insurance, as opposed to the government exchange, which I believe the sole purpose is about universal health care through the government.
Very interesting. Thank you.
Thank you, Randy, for your call here today. And at the same time, Twila, can't we see the federal government coming forth with more and more mandates upon the private health insurance carriers that now you must do this, you must do this, you must do that, to jump through a whole number of hoops that's going to cause them to be priced out of the market for many consumers?
Well, to some extent they can, but to another extent, insurance is really about state regulation. The regulation of insurance is, for the most part, under the state government. So they can try, and they certainly have done it through Obamacare, to try certain facets of it. But what you will see is, like even Wisconsin, I know for a fact that Wisconsin was trying to make their law compliant with the federal law, so that Wisconsin, the federal government couldn't just come in and tell Wisconsin, you have to do this. They had to have Wisconsin legislature say amen to it and put it into state law as well.
Our next caller is from Alabama. Irene, you're on the air.
Hello.
Go ahead, Irene.
Hello.
Irene, listen to your phone, not your radio, please.
I am listening. I talked with the guy before, and I was explaining to him about an article in 1986 about the various programs and who was getting the most money for those programs. And I just wanted you to know that everybody thinks that those programs are mainly black, and 80% mostly was for whites. And I'm not being racial. I'm only giving you information that I have here.
Okay, Irene, let's talk about the health insurance exchanges here under Obamacare.
That's what I'm talking about, the insurances here with Medicaid and Medicare and all of that. That's what I'm saying.
Okay, I don't believe, Twila, that there's any racial component to it that I'm aware of.
No, there isn't.
Okay, thank you for your call. To Pensacola, Florida, Lee, you're on the air.
Hi, how are you? Please forgive me, I'm a little bit nervous, but I just wanted to talk about how this is going to affect. You're talking about the exchanges and buying it and the consequences of whether you do it or not, but how is this going to affect the delivery of health care? Because if I could, I'd like to tell you a little story. Me and my wife are senior citizens, have private insurance, and we both have Medicare, or she's got Medicare. And last year she tore her knee up and needed a knee replacement, had some arthritis in there and just tore the meniscus up. No problem, got it done, a couple of months of rehab. Okay, this year, and about 3 months ago, she heard a pop in the other knee, and we went to see the doctor, and the same thing. Except this year, because I think he explained to us, because of the implementation of some of the rules, she now has to wait 90 days before she can have the knee replacement. She's got to go through the therapy and exhaust all the other resources. And, you know, the doctor's only been doing this for 35 years, and I think he knows when a knee needs to be replaced. And if you've ever had, you know, have to have a joint replaced and you have to go through bone on bone, you know.
It's a very painful thing.
It's very painful, and I just wanted to, if she knows, is this going to be the normal procedure? You got to go through 90 days before you get your operation?
Well, I just want to remind you and listeners that there are 2,700 pages in the law, and there are many things in the law that are going to make it more difficult for people to access care immediately, just because of some of the payment mechanisms. So I'm not clear on exactly what your doctor was talking about, but I can tell you that there are things like the Accountable Care Organization, and which is going to be the hospitals and the doctors coming together, and then they're going to receive bundled payments. In other words, one payment that they have to spread around, and they're going to get it per enrollee or they're going to get it per episode. But no matter what, it's going to change the entire way that healthcare is financed. It's not going to be financed for every little thing that is done. It's going to be bundled. And when it's bundled, then people are going to look at it and go, well, how much of this should we really use for that? Because, now we have to decide how it gets spread around. It's not for any particular procedure necessarily. So I think there's that. There's the IPAB, which is the Independent Payment Advisory Board, which is in Medicare, which is going to determine what should be paid for and what isn't paid for. There's PCORI, which is the Patient-Centered Outcomes Research Institute, which is going to do what I consider rationing-based research in order to determine what kind of services are available for people at what kind of age and what kind of productivity. I think there are so many things in the bill that have to do with how doctors are going to be paid or aren't going to be paid that are going to make a difference with how people can access care. So, what we want to do as an organization is essentially give you your money back, and you'll make the very best decisions with it. You'll be cost-conscious with it. And if you own your own health insurance policy, plus you have your money, plus you're really using insurance for insurance purposes as opposed to paying every last little thing with it, that would change healthcare, and that would get you services right away. But Obamacare is moving the other direction, taking more of your money, putting it under other people's controls, and making it more difficult for you to access care. And in the long run, we totally believe that people like your good doctor are going to say they are not in the business anymore. It's going to be very, very difficult to find doctors, and students are going to decide not to become doctors, because what student wants to have spent 11 to 15 years getting educated as a doctor only to come out and be told how to practice medicine, right?
So, bottom line, I hear that one three-letter word, Twila, yes, quality of care is going to be impacted.
Yes.
Wow. Well, we are just seconds away from a break here, so we're going to put our calls. You just stand by here, folks, until after the break. We'll get to your calls here right afterwards. We're talking with Twila Brase here today on Crosstalk from the Citizens Council for Health Freedom. Let me quickly give you a couple websites for you to check out: cchfreedom.org, cchfreedom.org, and stophealthinsuranceexchange.org, stophealthinsuranceexchange.org for more information on our topic today. They also have a phone number where you can contact them to obtain their newsletter and get on their mailing list. Their telephone number, 651-646-8935. We'll take a quick 1-minute break and then come back to more of your phone calls. You're listening to Crosstalk on the VCY America Network.
For the Worldview Weekend Minute, I'm Brennan House. Our website is worldviewweekend.com. Real spiritual warfare, what is it? It's not running around railing at demons, but destroying the lies raised up against the truth of God's Word. 2 Corinthians 10:3-5 declares, "For though we walk in the flesh, we do not war according to the flesh. For the weapons of our warfare are not carnal, but mighty in God for pulling down strongholds, casting down arguments, and every high thing that exalts itself against the knowledge of God, bringing every thought into captivity to the obedience of Christ." Real spiritual warfare is battling for the hearts and minds of people using biblical theology and doctrine, the truth of God's Word. That's what spiritual warfare is, proclaiming biblical truth, destroying arguments, philosophies, fables, ideas raised up against the principles of the Lord. It is not running around railing at demons, something even the angels don't do, according to Jude.
State health insurance exchanges is our topic here today on Crosstalk. Yeah, the intrusion of privacy, that's all part of it, folks. I trust you caught. We just scratched the surface on that topic as well, with the IRS having access to the information and many other agencies as well. But let's go right back to your phone calls. Gene, you've been holding the longest in Wisconsin. You're on the air.
Hello?
Yes, go ahead.
In order to guard themselves against fraud, about 108 years ago, around the year 1904, the insurance companies as a group set up a bureau called the Medical Insurance Bureau, known as the MIB for short. All the information anybody ever gave the insurance companies as they purchased medical insurance went into that bureau to be exchanged by any other insurance company. Now, I think that was just a private organization, and it was not ever mentioned to the public that all your information is there in that bureau. What you're proposing now sounds like it would cancel out that bureau. I don't know if that bureau is still operating or...
Twila, do you have any information on that?
As far as I know, the bureau is still operating. Yes, most people don't know about it, and it is insurance companies that set that up in order to have information when they're looking at underwriting a person to see, were they insured before, what kind of services did they have under the insurance. But yes, it was all about insurance companies and for insurance companies. I don't know if it will undo it. There might not be any more reason for it if the exchanges were up and running, because all this information would be shared, but it would be with the federal government. It wouldn't be with each other. But part of the reason why the bureau might not be needed is because what Obamacare does is it ends all underwriting. And underwriting means looking at you to see how expensive you might be, whether or not they can cover you, and if they do cover you, how much they should charge you. That's underwriting. But Obamacare says that everyone gets insurance no matter what, so that it really ends underwriting, which might be a reason to get rid of the bureau.
Jane, thanks for raising that point. Appreciate it. Let's go next to Buzz in Idaho. You're on the air. Hello, Buzz.
Yes, this is Buzz. Thank you for taking my call. My question for Twila is this, who are the big winners if these exchanges take place? In other words, just follow the money trail. Who's going to benefit the most financially from it?
Probably the biggest beneficiaries from the exchange are the health insurance plans. One of the reasons is because it will really cause the insurance industry, the market, the options for insurance to shrink down into only those insurance companies that are big enough to do all the regulatory, to follow all the regulations and do all the regulatory business that the federal government requires them to do. And so it will really cut their competition, but also through the exchange, they will get premium subsidies for people who are from 100 to 400% of federal poverty guidelines. 400% of federal poverty guidelines for a family of four is around $92,000. So for all of these folks, they get a premium subsidy, and it goes directly from the government, taken from your taxes, of course, but then it goes directly from the government to the health insurance companies, and that is facilitated through the exchange. The other thing that happens through the exchange is when you come and you're going to buy insurance and they find out that you are eligible for Medicaid, you are automatically enrolled in Medicaid, and you don't have a choice about getting private insurance. And then the Medicaid monies come from the federal government directly to the health insurance plans as well. So really, they are the big winner in the exchanges when you're looking at it as a buying tool. When you're looking at it as a registration tool, the government is the big winner because they're finding out everyone who is insured and everyone who isn't.
Well, I see. Well, thank you for that answer.
Thank you, Buzz. To Century, Florida. Maxine, you're on the air.
Yes, where does Florida and Alabama stand on this? Do you know?
I know that Florida, Rick Scott in Florida he was, I think, the first or the second governor to stand up after the Supreme Court ruling to say that he was not going to implement Obamacare. He was not going to implement the exchange. So I know that for certain. Alabama, I can't quite remember. I know Arkansas is moving forward, but I'm not so sure about Alabama. So I'm sorry that I just don't have that right at my fingertips.
Okay, well, thank you.
Thank you. And to Milwaukee, Marianne, you're on the air.
Hi, thanks for taking my call. Thank you for this information, your work, young lady. Can you tell me how this would affect the Samaritan Sharing Ministries? And also, I have a brother in a nursing home who's disabled and on Social Security. I'm concerned that they might pull the plug on him, and I don't know what to do about it.
Okay.
And the third thing I thought while I was waiting is, how is Sharia involved in all of this?
Okay, we've got about 60 seconds here.
I'll talk about Samaritan Ministries, because Samaritan Ministries is a health sharing organization, and it is one of 3 in the country. And if you are part of Samaritan Ministries or any of the other health sharing organizations, anyone who is a member is exempt from the mandate and therefore cannot be forced to pay that penalty tax. So, but you will have to register your exemption either on the exchange or on the tax form. I'm not exactly sure. I know it's going to be through the exchange, but I'm not sure if it's going to be through the tax form as well when you file your taxes.
And on the Muslim Sharia issue, are Muslims exempt? Is there an exemption there?
No, but the Amish are, because the Amish don't have Social Security numbers. And so that's really the exemption is for the Amish.
Twila, we've got 30 seconds. Thank you for the call here, Marianne. Wrap up some final thoughts you'd like to leave with the listeners today.
Well, I think what I'd like to tell them is to stay informed, and one of the best ways to stay informed is to get our weekly e-news, or also to get on to follow me on Twitter, Twila Brase, and you can find that at our website, cchfreedom.org, because this issue, whether you are free in healthcare or whether you are not, is really going to determine whether we are free as a country, because this is about our lives. And they will determine when our life is valuable and when it's not, and when it's worth saving and when it isn't, and that's not where we should be as a country. So this is really key to repealing Obamacare, is really key to maintaining our freedom in this country.
Well, Twila, we appreciate you carving some time out to join us here to inform our listeners on these important issues.
Thank you so much, Jim.
Twila Brase has been our guest here today. Again, folks, you can check out the website, and that's cchfreedom.org and stophealthinsuranceexchange.org. If you don't have access to the web, their phone number is area code 651-646-8935. Thanks for joining us today on Crosstalk.
You've been listening to Crosstalk via satellite and the internet from VCY America. Views expressed may or may not be those of this station. For a CD of today's program, send a donation of $6 or more to VCY Take Ministry, 3434 West Kilbourne Avenue, Milwaukee, Wisconsin, 53208, or download by RSS or podcast from crosstalkamerica.com. And join us again for Crosstalk.